Montgomery Showers, local quality value, MontgomeryShowers.com.
If you have ever had a time in your life where you had to go to the emergency room, I'm sure you were hoping that the emergency room was going to be close by. That convenience is very, very important. This is Dr. Daniel Poor. He is here with Parkridge this morning talking about their freestanding emergency rooms. What a brilliant idea to literally take the medicine and the care to the community, right?
And that's what we're trying to do, is take it to the community in areas that are maybe underserved or not underserved. One of the newer locations that we have is our Camp Jordan freestanding emergency department. And just, you know, for your viewers to sort of talk about the difference between those things, typically you associate an emergency department attached to a full-size hospital, like the front door of the hospital and the emergency rooms either on the side or in the back. The freestanding ER is a full functioning emergency department without the hospital. So when we treat people, if they require transfer to a hospital, we can send them over to our main campuses. But the quality of care is exactly the same. We have CAT scan, ultrasound, x-ray, and then you have board certified physicians that are there with an adequate nursing staff taking care of everybody. So any emergency that comes through that normally would go to an emergency department can also come to the freestanding.
So that you have, is it 5 or 6 of them in the area? You mentioned Camp Jordan.
We have, so 4 freestandings in our 2 main campuses. So our Parkridge main campus and then our East campus.
Very often, I was kind of joking with you before we got on the air. I have 2 daughters, and I said I think every parent in the area has been at the ER at least once.
Absolutely.
With a broken arm or something with their kids. But sometimes there is that questioning you have of, should I go or should I not? You were pretty quick to say, if you have any doubt, come on.
Oh, always, yeah. So, I mean, especially in like cold and flu season, and you know, moms and dads get nervous, especially new parents. Remember what it was like when you had your first kid versus your second one. The second one can be on fire. I'm not going to go to the ER. The first one's like anything that happens, we're going to go in. So we encourage everybody to come through. What is your emergency, right? It doesn't matter. It's your perception of what needs to have medical care at the time. So please come in and see us, and we can either reassure you and send you home, or your mother instinct really kicked off. You're absolutely right, and then we have other things to do.
You mentioned the cold and flu season that we've had right now. I mean, it's been a doozy between the norovirus and the flu. So often I think people too have concerns about sitting in a waiting room for too long, because who knows what you're going to catch.
Right, and I'm glad you brought that up. So our freestanding has a really moderate volume, but our wait time in our waiting room is minimal. We get people in the back almost as soon as you come in and fill out your paperwork, you're in a room. And that's one of the things we focus on, is how quickly can I take the patient that arrives in the department and put them immediately in front of a provider. And that happens really quick. I mean, usually within 5 to 10 minutes on average, and that's when we're getting them back immediately seen by a doc, orders, exam, everything is in, nursing staff at bedside, and you're taken care of.
Is there any kind of protocol you should know when you go to the emergency room? Because y'all see all types of things every day.
We do.
You're probably pretty quick at assessing something in a second. So do we sometimes as patients give you too much information?
I don't need to know your favorite color or the name of your dog. Anything up to that, I think we're pretty much good.
Yeah.
And our job with residency training and the volume and everything, I have a pretty good idea when I walk in the room whether or not you're going to stay or go, right? Based on your chief complaint and your history. So I can already kind of get a feel within the first couple of minutes if you're going to stay, if we're going to stay and play, or if we're going to like send you off someplace else.
Let's say you have to stay and play. And you're at a freestanding one, then you're going to send them by ambulance to one of your 2 hospitals?
Yes, ma'am. Sometimes you can go by private car, but that's not usually recommended. Usually what we're going to do is we're going to take care of you. You're going to have an IV, you'll have fluids, you have medications going through the IV. And I can't send you in your car with an IV in your arm, right? So we're going to, because then you get stuck again by the time you get there. No one wants to get poked twice. And then we'll send you by ambulance to the higher level.
But you'll do the transport for them.
We'll do all of it. Yeah, we set everything up.
So, you know, COVID changed an awful lot of things where people couldn't come back into rooms with people, that distancing was such an issue. I guess that's gone now. Is it beneficial if you're having an urgent need to have someone go with you?
Oh, 100%. So some of our sort of geriatric patients that may have some memory issues or that kind of thing, it's always better to have the family member who has a knowledge base of them, their history, all their recent visits, to kind of fill in some of those gaps that may be associated with memory loss. And especially, so the young and the old always needs to come with someone so we can get a good story and get a good background on all the things that they may forget. Because when you're in the bed, it's remarkable how quickly you'll forget things about yourself versus your loved one at the bedside.
Is there anything, I know we touched on the whole viral situation going on right now, but anything to be thinking of as we go through these spring months? I guess people are a lot more active. Do you see a lot more bumps on the head and broken bones?
I mean, it
this time of
depends.
year?
So, you know, like sports are kicking off, there's baseball, there's all sorts of things, and then people are getting out. So I always get nervous about the weekend warrior that's done nothing for the weekend and then wants to go run 3 miles over the weekend. Like those guys, if they come in with chest pain, or gals, like those are concerns for, like, you know, cardiovascular disease and that kind of thing, which we do a good amount of that at Parkridge. We have a great cardiovascular service. So if you come to the freestanding with chest pain, we look at all the risk factors, we do EKGs, we do troponin levels, cardiac enzymes, all those kind of things, and see whether or not you need to go to the hospital for a stress test or to cath lab or any of those other things. So we handle STEMIs, everything else.
Have y'all gotten to where you're a little bit more judicious, I'll use that word, in sending someone home with pain medications? Should people kind of be prepared for?
It depends on the situation. So I don't want to prep anyone to think you're going to show up and just get a pill and go to the house, because you never really know what exactly is happening. Abdominal
You have to
pain,
gauge the situation.
Well, that too. So like if you come with abdominal pain, what's the reason for it? Is it appendicitis? Is it a number of other things? And sometimes that requires a further workup and then imaging. So we have a CAT scan on campus. So we can send you through the CT to see if it is appendicitis or just maybe a GI bug.
So these 4 areas that have the freestanding, let's say you're in the Eastridge area where before you were thinking I better head down Macaulay, maybe don't. Just come to the
Come over to Camp Jordan
freestanding.
and hang out. And if you get discharged, there's great places to eat. There's a park nearby. You can take a walk.
If you win the lottery
If you win
and get
the lottery,
discharged, there
just
you
come
go.
by and hang out.
All right, so here is where you can go to find the closest one to you, which is parkridgehealth.com. 4 locations that are freestanding, of course, the 2 hospitals in town, and always a team of medical staff there to make you feel better as quickly as they can. Thanks.
Thank you.
An important message for Americans ages 50 to 85.
That's how it ended. I remember that.
You talked her into